Hi, my name is Dr. Pete Davis. I'm a diabetes consultant in Sandwell, and I'd like to tell you about diabetes results delivered to you. This is a process that helps us communicate with, to engage, and to empower people with diabetes in our area. It's a means of sharing the important HbA1c blood test result to people by mail. It allows people to get their result fast, in advance of their care planning review, helping them reflect, and we design it to be very easy to understand. We do this through effective use of colour. We give both the current and the past result to show the trend. We use arrows and clear numbers and very clear categories, and we use simple descriptions that have a low reading age. We give very clear instructions on what people should do next. By doing this, we hope that we would help people understand their diabetes and engage better in care planning processes. In short, that they would understand diabetes and take control. The process itself couldn't be simpler. For any practice that opts in, we then automatically send out from the laboratory the HbA1c blood test result. No further action is required on the part of the healthcare professionals. Does this help? Well, we've evaluated it in 8 local practices as well as my own specialist practice. So that includes over 1,600 people with diabetes. And the results speak for themselves. 72% said getting their results in this way helped. 75% it helped them talk to their doctor or nurse. Almost 90% wanted to get their results this way in future. And when we asked healthcare professionals if they thought this helped, 61% said it directly helped their consultations, and there were no extra time pressures for them. Did it change people's behaviours? Well, it did. Many patients reported positive changes to their behaviour, for example diet, physical activity, and taking their prescribed medication. All of this exceeded our expectations. After all, this was an unsolicited mail item. HbA1c is a pretty abstract concept, and the units had changed, yet we only gave the new units to our patients. This costs around 37 pence per mailer item, most of which is postage. Why are we posting it, you may ask? Well, we did a voice of the customer survey, and almost 2/3 of people told us that's how they wanted to receive this information. We were meeting the needs of our customers. In future, these costs could be eliminated, for example if electronic transfer of information into personal health accounts comes into being. So in our health economy, it would cost around £14,000 a year. But what that buys is more engaged and empowered people with diabetes who report positive behavioural change. The beauty of this idea is that our specific content about diabetes and HbA1c could be very easily and readily changed. We can apply this to other long-term conditions. The technology is cheap and could be applied in any health economy throughout Britain, and it gets much cheaper in the future. Our next step is to get this commissioned long-term for the people of Sandwell. Thank you for listening. Please contact me if you have any questions about our project. Thank you.